Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. Tonight's topic is focusing on acupuncture. What can it do for you? Find out right now. My guest this evening is Dr. Michael April, a noted acupuncturist in Montgomery County. Dr. April, welcome to Housecall.
Well, Dave, thanks for inviting me here.
My pleasure. So briefly, tell our viewers about your professional background.
Well, I'm from the area. I went to high school, Wooten High School. Went to undergrad at Johns Hopkins University. I have an engineering degree, and then I went to medical school at the Medical College of Virginia.
Very nice.
In Richmond. I then did 2 years of general surgery at the Washington Hospital Center, and then I decided to go into physical medicine rehabilitation. Did a residency at New York University Medical Center. And once I finished my residency, I started in private practice back in Montgomery County.
So you offer many services within your practice, one of which is acupuncture.
Correct.
And then what kind of training does one require to become an acupuncturist?
Well, it depends if you're a physician or not.
Right.
As a physician, it's state by state. So in Maryland, it was 200 hours of training, which sounds like not a lot, but they understand that you have this big base of knowledge in medicine. So it's a lot easier for you to pick up how to get started in acupuncture. Some states in the United States, you don't need any hours of training. You can just say you're an acupuncturist.
Really?
If you're a non-physician, I believe it's about 17 hours to get nationally certified. So for our training, what happened was there was a doctor at UCLA who decided to put together a program for physicians, and the whole reason really for doing this was to increase the use of acupuncture in this country. So they felt that if we get a lot of physicians doing it, it would greatly increase the use of acupuncture and get a lot more people using it and seeing the benefits of it.
What exactly then is acupuncture? Define it for our viewers.
Well, the term means pierce with a needle. It really, when people think of acupuncture, they think of treatment with needles. It's really a lot bigger than that. There are a lot of other techniques that are used with acupuncture. But it's a whole system of medicine that was developed by the Chinese over 2,000 years ago. Mm-hmm. And they found that there were certain points on the body that had special properties. What's interesting is when you read some of the books that go into traditional Chinese acupuncture, every point in the body, and there's about 400 points, has been described and given special properties that sometimes can be kind of interesting or funny. I mean, there are points that get rid of ghosts. Or, I mean, again, you have to remember this was developed thousands of years ago. But it's a whole system of medicine that uses these points on the body, and the way you use these points to change somebody's health is by contacting them with these needles. Now, over time, other ways have been developed to manipulate these points. Lasers, you've heard of cupping, that became big at the Olympics in Rio.
Define for our viewers cupping.
Cupping is a technique where you take a cup, and traditionally what you would do is you would take fire and go around the edge of it and basically expel the oxygen from inside, and then you would stick that cup down on the area that you want to treat.
It creates a vacuum.
Right, and what it would do is it would draw blood to the area. So what you'll see is when people have had cupping, you'll see bruising around the area.
And why does drawing blood provide benefit?
It's anti-inflammatory and helps stimulate healing.
Okay.
When we did our training, it was kind of interesting. The professor who at the UCLA course, we had to watch videos on some of the training, and at the end of the videos he would stick on some like interesting things from his travels in China. And what was funny was one time it was like a contest who could put the largest cup on a person.
Yeah.
And these guys were coming up and they were taking these huge cups,
Yeah.
like basically the diameter of a person's whole back.
Yeah.
And then they would go around and stick it on the guy. I mean, it's kind of funny. But because cupping has become very popular now, especially with sports, a lot more people are doing it, especially athletic trainers, physical therapists, and you can get fairly inexpensive units to do cupping, and I've done it with trainers at international competitions. But that's a part of acupuncture. So again, when you think of acupuncture, you think of needles, but it's not just needles. It's a lot of it has to do with the points on the body, but in addition, other methods have been developed with the acupuncture, and it's really in the whole realm of traditional Chinese medicine. So there are also herbs, which go along with the acupuncture, or using the needles too.
And what herbs, for example, do you use when you're using acupuncture?
Well, because our training was pretty short, I have not gotten into herbs that much. I mean, I use some. I use ashwagandha. I use, I use Siberian ginseng. I mean, there are a few things I use. I had for a while. I had an herbalist with me, and she was very good with herbs. I personally don't prescribe them that often. I usually refer people to find somebody who's better with those. But people who do traditional Chinese medicine, that's a big part of it, is using herbs. And that's a whole another topic, as you know, where people think herbs, because they're not prescriptions, they don't have side effects, they don't have interactions, and you have to be very careful with those too.
Yeah, actually, as a gastroenterologist, I sometimes see some of the complications from herbs, including liver disease.
Yeah.
What briefly is the rationale for adding herbs to the acupuncture?
Well, it's just to help stimulate the body to get better. So, I do plenty of acupuncture by itself.
Sure.
But as a physician trained traditionally in this country, I'm using prescription medications, and I'm using other types of things with the acupuncture. I would see it as traditional Chinese medicine. They, instead of using prescription drugs, they see herbs as a way to help with the treatment. So do you have to do that? No. You can do acupuncture by itself. You could do herbs by themselves. But it's another way to kind of fortify and help the treatment along.
You mentioned earlier thousands of years in China, they identified these hundreds of points to provide acupuncture. And my understanding is that in traditional Chinese medicine, they talk about energy currents and meridians. Can you explain to our viewers what that is all about?
Well, the traditional teaching is that you have this, what's called qi, which is like the vital fluid in the body. And what you're trying to do is get the qi to flow properly. And this is all traditional Chinese, which I will say that more recently this stuff has been kind of
challenged.
Yes.
Yes.
So what happens is you have these 12 basic meridians, and you have yin and yang.
Define that, please.
Yeah. Well, they're opposite. So like you have heaven and earth, and you have in and out, and cold and hot, and one is yin, one is yang, and what happens is it's very interesting when you look at the descriptions of disease states, how you can, certain types of conditions fit into these problems with deficiencies or excess of some of these areas. And it's interesting, and what I've told people, the way they look at medicine versus we do is they look at the whole body, whereas we tend to look at, like, okay, you have a peptic ulcer. Or,
Right.
Not that you do that, but,
Yeah.
but we tend to do that. And they look at, okay, this peptic ulcer was caused by something that's not right in the body.
So they're more holistic.
Correct.
Yeah.
So that's how, when you do treatment and with acupuncture, traditionally that's how you would look at a patient. So you would spend time looking at what is out of balance. And so you have the 12 basic meridians, and then there are other ones. And the meridians are connected, and you have the yin and the yang. So if you have something that's acute, you would treat it one way, and if it's chronic, you treat it another way. And you have to look and see which of these meridians do you think are they're not functioning properly. And again, they're connected. So I'll give you an example, like the small intestine meridian and the bladder are connected. So if you felt a person fell into a problem where they were an issue, you would be looking at points in the small intestine meridian, the bladder meridian, which on the other side connect to the kidney and the heart. So you would focus on moving energy in those meridians. Now, I said meridians, that's a whole. So on the body, you have these points that are on a line, and there are these 12 meridians that I just mentioned. And these points are all associated with each meridian. They have specific points. And some of the meridians can have 10 or 15 points, and some of them can have 60 points. And those are the points that you then pick when you want to treat somebody. And then you just have to figure out on each meridian. So again, like I was saying, you got small intestine, bladder. You would pick some points on the small intestine meridian, some points on the bladder meridian. Now, does this mean that they're on the small intestine? No. Do they have some effect on the GI tract, small intestine? Frequently. So the ones that are associated with that particular meridian, usually some of the points do have some effect on, let's say, the bladder or the kidney or the spleen. But these points can be all the way up the arm to the chest. Like the lung can start here and go all the way up to here. Okay, so it's near the lung.
Yeah.
But like you look at the stomach goes all the way to the foot and comes up. So it's not near the stomach. But some of the points do affect the stomach. So that's why it makes it very complicated and there's so many points.
We have a minute before the break. What are the anatomic correlates to what we're talking about here?
Well, like I was saying, the meridians have some correlation with those organs. But to give you an example, like gallbladder 34 happens to be a very good point, but it's for muscles, bone, tendons. So what does that have to do with the gallbladder? But it happens to be a very big point for musculoskeletal. So some of the points will, but a lot of them don't have to. So that's what makes it complicated, because you're talking about using these meridians on a problem that has nothing to do with what it sounds like it would affect.
All right. Well, we're going to pause here for a moment. In a moment, we'll be back. We have an upcoming public service announcement. When we return, more with Dr. Michael April and what's new with acupuncture. We'll be right back.
The odds of this boy achieving his dream in fashion? 1 in 23 million. The odds of having a child diagnosed with autism? 1 in 68. I am Tommy Hilfiger. Learn more at autismspeaks.org/signs.
We're back. My guest tonight is Dr. Michael April, and we're discussing acupuncture. Dr. April, when we paused for the break, we were talking about some of the theories of acupuncture, and you focused on the meridians and the energy forces that Chinese traditional medicine has embraced for over 2,000 years. Share with our viewers, though, some of the contemporary research on why acupuncture perhaps provides benefit.
Well, for one, I would say pain is probably the most studied thing, and the thing that I think people think about the most. Although I will say GI, GYN, psychiatric problems happen to be fairly well represented also. But a lot of the research has been done on pain, and what's been found is that there's a lot of things that happen when you put a needle in somebody. You have a local response where you have increased blood flow in the area. You have release of certain local chemicals that affect pain, affect healing. But you also have effects as far away as the brain. And studies have been done with PET scans and functional MRI to show changes in blood flow.
These are special x-rays.
Right.
Right, okay.
And those have been used to see changes at the brain level when you put a needle in farther away in the arms and legs. So what's been found is that you get these local changes from the needles, but you also see changes at the spinal cord level. You see inhibition of pain signals. You see release of certain hormones in the brain which affect pain, oxytocin, serotonin. I think one of the issues in pain in general, there hasn't been a lot of research until more recently. It was an area that was just not well studied. So more stuff is being done in a lot of areas of pain, and acupuncture happens to be one of them. So there have been a lot of studies done on what is going on, how is this working, and so that's what we found is that these are some of the things that are going on, and at multiple levels. So because pain can be so complicated, we are always looking for multiple channels to try to treat that. And I happen to use acupuncture a lot for sports injuries, and for many years. And I've seen firsthand the kind of things you can do with reducing inflammation very quickly, stimulating healing. I tell patients frequently, when there's a question, I tell them, in 1997, NIH had a consensus conference where they concluded that acupuncture works. They looked at all the studies, and they picked out certain diagnoses, which I always find kind of crazy. That there's so many things you could study, but they picked out specific things and said, well, we have a few studies here that did show that it worked for low back pain, tennis elbow, things like that. But they did conclude back then that it did work. Again, you still have people now who say that there's no science behind it, but I don't know, we always say, well, I don't know, the Chinese have been using it for thousands of years. So.
You mentioned briefly there's different styles of acupuncture, and of course it originated in China, and then I understand geographically it was embraced by Korea, and then went on to Europe and the USA. Are there different styles of acupuncture depending on whether the acupuncturist is from China, Korea, or the West?
Yeah, there are. In fact, the training program that I did, the UCLA, it uses French energetic, which was before what's called traditional Chinese acupuncture that's in China after the revolution, as the French were there before. They had what was called French energetic, which is what is taught in that course that I took. But you do have different ways of looking at acupuncture. You have the Japanese, Korean, you have, again, the French, Chinese. Not only that, you have different, like you have Korean hand acupuncture.
No
which
needles,
is-
just the hands.
No, well, they use needles in the hand.
Okay.
But it's a whole nother system.
Yeah.
There's Yamamoto new scalp acupuncture. And I did a workshop with Dr. Yamamoto. That's using the scalp. Happens to be very good for neurological problems, spinal cord injury, stroke, head injury. So you've other systems have been developed, and in some of these other countries as well, as you mentioned, Korea, Japan, they have different techniques. They prefer sometimes different types of needles. And you constantly see people coming up with new things. Again, Yamamoto came up with this new system not too long ago, and it's gradually growing. And I know when he gives seminars, I mean, they're just packed. So yeah, there's a lot of that's what makes it interesting, but can be confusing because there's so many people doing it in different ways. And so how do you compare results, and how do you know what you're going to get?
Sure. Has there been any comparative studies between different techniques?
I have not. I'm not aware of comparing the different studies, and even when you look at, there's some people, I haven't mentioned auricular acupuncture, which I do
Auricular meaning
occasionally.
the ear.
Right.
Okay.
There are people who only do ear. The entire body is on the ear. And
Amazing.
there are hundreds of points on the ear.
Yeah.
And there are probably people familiar with little balls you can put in the ear for like weight loss, and you rub it. Those points are ones that are felt to be good for weight loss. I explain to patients it's really not that simple. It's not like, oh, there's that point for weight loss, let's treat that.
Yeah.
It doesn't work that way, because as I was saying before, really what you would be looking at is, why is this person overweight? What things are out of whack that we need to correct to get them to lose weight? And it's not just one point is going to do that.
Yeah. You mentioned in the top half of the show cupping. What are some of the other things you can add to acupuncture adjunctively?
Well, some people may be familiar with moxa.
What's that?
Moxa is mugwort, and it can be used a few different ways. You can go to an acupuncture point and take moxa and basically burn the skin briefly, and you scar it. Or you can leave it on briefly and not cause scarring, which I would find better.
Yeah.
Or you can heat the needles with the moxa. Some people put heat lamps on the needles. I prefer electroacupuncture.
So you add an electric current to the needle.
Correct. So I figure out which points I want to stimulate and move energy in a certain direction. So let's say I might put 10 needles in a patient, but and might be 5 on each side, let's say. I might connect 2 on each side to electricity. Now, if I'm doing a pain patient that has what we call myofascial pain and they have trigger points, I might just put a couple needles in the trigger point and hook up the electricity to it. But that's what I prefer to use, electricity. But laser's another one. There's a woman up in Massachusetts, Margaret Nazer, who's very big on using lasers. So especially with kids, she finds it very helpful for strokes, carpal tunnel, and she treats mainly the hands.
Yeah.
And so she's not using needles, she's using the laser on the acupuncture points.
Interesting. When you just put the needle in and you don't add electrical stimulation to it, do you twirl the needle or just leave it in there for a few minutes?
Well, that's another. You can twirl it depending on what direction you want to go in, and there are different things you can do with the needle to either stimulate or dampen the effect. So you have to determine what you want to do with that particular point. So just as I would hook up electricity, somebody else might twirl it in a particular way. Again, being in the U.S. healthcare system and not having the time to twirl needles, and I tend to put them in and I put electricity.
Sure.
So because some of these things, it's a lot of time with one patient if you're going to be doing that by yourself. So, but I've always just been more comfortable putting electricity on the needles.
Sure. Now, many of our viewers may be phobic of needles. So what do you say to them in terms of the size of the needles you're using?
Well, I mean, sometimes they want to see it, sometimes they don't.
Okay.
If they want to see it, I'll show it to them. I tell them they're very thin needles. I don't tell patients you're not going to have pain, because you're going to feel something. Because people will come in and they'll say, well, I heard acupuncture was painless. I mean, they're extremely thin. Now, depending on the patient, I could decide to do different types of treatments. I don't have to treat, let's say it's a pain patient. A lot of times if I get an acute pain patient, I want to treat the area where the pain is first. But that might not be good for that patient because they won't tolerate that. So I'll go farther away, or maybe I do the ear. And with the ear, I can either put needles in or I can put little gold tacks, and then they stay in.
Interesting.
So they'll stay in for a week.
How long does one treatment take? Patient comes in to see you. How long does the session take?
Generally, it's 20, 30 minutes.
20, 30 minutes. And is it generally covered by insurance at this point?
Not Medicare.
Not Medicare.
Medicare will not cover it.
How about private insurance?
A lot of them do.
All right.
A lot of them. I mean, Blue Cross, United, Aetna, Cigna.
Now, we have about a minute and a half left for tonight's broadcast. You've mentioned pain management and wear and tear injuries from sports, but briefly explain to our viewers what are some of the other potential uses of acupuncture.
Well, your field is a big one.
Gastroenterology.
GI is very big. GYN is very big too.
And what are some of the examples of GI and GYN? What kind of disease states are you treating?
Irritable bowel syndrome.
IBS, yeah.
That's a big one. GERD.
Reflux esophagitis, yeah.
I mean, those are
Yeah.
common ones that you're going to see. GYN, there's a lot of endometriosis.
And pelvic pain and stuff like that.
Pelvic pain. And just hormonal imbalances.
How about smoking cessation?
That's a big one.
Yeah.
Smoking, and also drugs. A doctor up in New York at Lincoln Hospital got very, very famous for coming up with a regimen to treat cocaine, heroin, and that's become very popular.
Well, we unfortunately are out of time, so if our viewers have any questions about acupuncture, how can they reach you?
Well, I have a website, www.end-suffering.com, and they can ask questions on that. And my office number is 301-770-6301. I'm always happy to answer questions. And patients, I'm always happy. Even if they don't become patients and just want me to answer things, I'm always happy to help out. I feel if I can help them get better, even if I can't be the person doing it, that's fine, as long as I can educate them.
Mike,
I believe in education.
Thanks for joining us on Housecall.
Well, thanks for inviting me.
My thanks to Dr. April for joining us on Housecall. My thanks to our terrific team here at the station. And thanks to you, the viewer, for welcoming us into your home. Let us know how we're doing. You can reach me at my practice website, montgomerygastro.com. As for our next show, it's going to be a very interesting one. We're going to have the medical director from the University of Maryland Proton Beam Center discussing the new role of proton beam therapy to treat a variety of cancers. It's going to be a fascinating topic. See you then next time for another edition of Housecall. Good evening.